on research ethics by Professor Dr. S. Lokesh, Scientist E, Deputy Director, ICMR National Institute of Epidemiology, Chennai. He has 14 years of total clinical and teaching experience, and he has 42 publications in international and national journals. He also has experience as a member of Human Ethics Committee, as member secretary at MGMCR Pondicherry for 5 years, as a clinician scientific member at MGM Pondicherry for 2 years, as a clinician and scientific member at ICMR NIE since January 2022. Over to you, Dr. Lokesh.
And with this, I would like to go ahead without wasting much time on research ethics. Again, it's a quite broader area, and I'll be giving just key principles of ethics involved in human research. And over the past few hours, we were trying to analyze why is that research essential and who gains out of it. And these are various components that were addressed by previous speakers. And basically, as an investigator, we need to basically understand the disease process, do a proper literature review, understand what is existing, have good research question or hypothesis, and have a sound knowledge on what are the treatment modalities that are available and what is that is new, and try to evaluate it. And research is not only with respect to the disease per se. So research may be something to do with curricular change or involvement of new teaching learning methods. So one need to have a solid idea of what is existing, and finally, once you have a sound research proposal with you, it has to be conducted with basic ethical principles in order to conclude the results and to extrapolate it to the general population. And who gains maximum out of it is the general population or the study participants to which the study is basically designed to address. So I would like to highlight few unethical or ethically incorrect measured studies which were done in the past. So to give you a few examples, we are aware of this Dusty syphilis study, which was done between 1930 to nearly for about 4 decades. And though penicillin, the drug of choice for treating syphilis, was available back in 1920s, the research participants were made devoid of this particular drug just to understand and study the natural course of the disease per se. The participants were deprived of giving this drug, out of which this study was basically done on blacks. That's another issue. Nearly about 600 black men they died, and another 1/3 of those who survived were pregnant women. And moving ahead, the Jewish Chronic Disease Hospital again conducted a research on healthy volunteers where to study the natural course of the cancer cells were injected to them without taking consent. That is what the key area that revolves around any research as such. And again, we have a good number of such examples. We have Willowbrook State Hospital, wherein the mentally retarded individuals were administered with viral hepatitis, again to study the natural course of viral hepatitis. And many of them, they developed sequelae to hepatitis in the form of cirrhosis and irreversible liver damage and succumbed to the viral illness that was induced in them. And University of Iowa in 1940, this is again a major study, also called as monster study, which was a stuttering experiment which was performed on nearly about 22 orphan children in Iowa in 1929 or something, wherein in order to look at the impact of speech therapy, the orphans were divided into two groups. One group received positive speech therapy and the other received negative speech therapy in the form of stuttering. And many of the normal speaking orphan children who received the negative therapy in the experimental arm suffered negative psychological effects, and some retained the speech problem for the rest of their lives. These are certain major trials wherein ethics was totally murdered. To list yet another is the hexamethonium study, which which again in the consent they did not mention that it is a experimental therapy. It was done among asthmatics as well as in normal individuals. Many of the normal individuals who were exposed to hexamethonium by inhalational route, normal individuals, they lost their lives. Again, we have these high altitude experiments, which were basically carried out to establish the critical events that lead on to deaths among pilots who, when they abandon their aircraft, when they rapidly descend from high altitude to low altitude in order to see what exactly that goes wrong. A scientist, a physicist come scientist named Rasher used a decompression chamber to simulate high altitude conditions. And he again recruited participants who were vulnerable. I mean, some of the prisoners were involved and they were subjected to such high altitude conditions, and their brain was dissected when they were still alive to demonstrate that the sickness which results is as a result of formation of air embolism or tiny air bubbles within the blood vessels. Similarly, in order to explain the freezing concepts, again during World War II, in order to see how long can a German pilot survive in extreme cold conditions in North Sea. Again, the same physicist and scientist Basher attempted to duplicate these extreme cold conditions, wherein about nearly 300 prisoners were exposed to extreme cold conditions, and nearly about 80 to 90 of these subjects they lost their life. And as I mentioned already, the Tuskegee syphilis study, nearly around, if I can highlight here, nearly about 600 black men they lost their life. Though the drug of choice penicillin was readily available in the year 1920 or 22, they were deprived of the essential drug in order to study the natural course of illness. Similarly, Goldberger, on his study on pellagra, he again took uh, individuals from orphanages, asylum, and prison, where he induced pellagra by modifying their diet, identified the symptoms and the natural course of illness, and few people lost their life or had to suffer due to therapeutically induced pellagra. And he also later supplemented niacin, which is a vitamin B, which is essential for our uh, regular nutrition as a nutritional supplement, which is very much essential, which in its deficiency leads on to this pellagra. So he induced pellagra and he also cured them by giving therapeutic doses of pellagra. And these were certain studies which were considered landmark studies, which were considered to be ethically wrong, basically, because all these experiments were performed among subjects who are considered to be vulnerable, prisoners of war, civilians of occupied countries. Again, those who are uh, incurably ill, those who are unable to give a valid consent, those who are physically and mentally challenged. And in most of these trials, the participants were not informed about the study process. And I think the process of consent absolutely did not exist in any of the studies. So, looking at these many major trials wherein there was a major flaw in ethics, serially there were many reports which came into protect the human participants, to mention few of the Belmont reports and then the Declaration of Helsinki. And have chosen, and I'm just a slide on this Nuremberg Code because this is one which basically highlighted the importance of informed consent in the human research, and also uh, this highlighted on certain key elements which we already learned during this past 1.5 to 2 hours of our discussion. Is this, is this that the individual should yield a result which would be fruitful to the community, not just reinvent one which has been already proven without any doubt. And it has to be based on prior knowledge and, as mentioned previously, need not be totally innovative. Novelty may not be always the determining factor. There may be few concepts which probably were identified earlier, which may lack scientific evidence either to prove or disprove its use in clinical practice. So even that can be studied. And always ensure that there is no harm to the research participants. And based on this Nuremberg Code, based on WHO norms, we have certain general principles which were adopted, which outlines the responsibilities of investigators who are involved in this study. That is what I'm going to speak over the next few minutes. The three important principles that we need to remember is the beneficence, which is nothing but component that looks at the benefit to the research participant, has to make some positive research contribution. Non-maleficence is basically it cause no harm to the research participant, and one need to respect individuals' rights and dignity of participants. And to sum up, it is the respect to the person, benefit to the research participant, and distributive justice that determines the key component of participant protection. As I mentioned before, we need to follow certain basic principles of ethics whenever we write a proposal, whenever we conduct, when we publish. Publication part of it will be covered in the subsequent presentation. The first principle what we need to keep in mind is the principle of essentiality. The research that you are intended to do should be absolutely essential. Just because of doing the research, don't try to reinvent what is already without any doubt. Why one must not go in for if there is no essentialities, basically because there will be a lot of loss of human resources, a lot of wastage of reagents, and duplication will be of additional input to the scientific community. And research involving vulnerable groups, as I mentioned earlier, prisoners, children, pregnant women, those crime-struck communities, and those who have disabilities or challenged, who will not be in a position to really understand what the disease is all about and what the experiment is all about. Those who are not able to give their written consent. Any research on this particular group should be specific for that particular vulnerable group. It should address the health need of the given vulnerable individual group. And studies which need to be done, studies for the betterment of non-vulnerable groups should be first done among non-vulnerable, its efficacy, and then involve. Second principle is the principle
Dr.
of
Lokesh. Dr.
yes.
Lokesh, Pratish,
Yes.
if I may just interrupt you for a minute, the
Yes, please.
participants are not able to hear you quite a little clearly. Could you just about there's an audio, there's an issue with the thing.
Okay, just a minute.
You would speak a little louder, or if you just
Sure. And now, how is my voice?
Yeah, it seems a little better. If you could get feedback from the chat, if it's, I think it should be all right.
Okay.
Yeah.
Fine. Please interrupt me if the problem
sure,
again.
Sure.
If it continues. So let me move on to the second principle. That's principle of voluntariness and informed consent. The concept of voluntariness and informed consent is something that is very much essential, and it's a key component of any research for that matter. And research need not be always on the deceased individuals. It may be in the healthy. It may be among the healthy individuals in the community. It may be among the employees of the same organization. It may be among the students who are under your control. So ensure that the participants are given the free information about the research and given the information about voluntarily being participating in the study. The component of coercion is something that we all need to keep in mind. So never compel any research participant. Similarly, do not hide any essential facts involved in the study. And always keep in mind that all the positives and negatives about the particular research has to be clearly informed to the research participants, and ensure that they voluntarily participate. And it's not only the consent should not be only for agreeing or for not agreeing for an individual to participate in the study. Also, that a clause on withdrawal, if an individual who has consented before would like to withdraw, he can withdraw at any time, and they need not quote the reason for withdrawal. So all these key components need to be reflected in informed consent. So you can refer for participants from India. I think The ICMR gives clear guidelines on what are the components of informed consent, what we need to follow. So please refer all those standard guidelines. These are certain key components that need to get reflected in the participant information sheet. This informed consent is signed by the research participant after they go through the participant information sheet or the patient information sheet, which need to be prepared in the patient understandable language. Do not use any complicated terminologies here. One need to clearly define the purpose of the study, including the title, the identity of the researcher, the sites where the study is conducted, and the eligibility criteria of the research participants, the benefits and harm that an individual can face if they participate in the study, privacy and confidentiality of their data, the future use of the research results, and right not to participate and withdraw is something that is very important. And the right to get help, that is the contact information of the investigators as well as the site, including the ethics committees of all the centers, need to be reflected in the participant information sheet. Once it is read, understood by the participant, then finally they give their consent either by signing or by giving their thumb impression. And you can involve the so-called impartial witness. This we often come across. The research participant may not be literate. They may not be able to clearly understand and give their willingness. In such situation, you can have an impartial witness. Say, for example, if you are doing a study in a hospitalized patient, when the patient alone is available during the time of interview, when there are no patient bystanders, you can request the bystander of the nearby patient who are literate, and they'll be observing that the content that is administered by the investigator is what is written in the participant information sheet and what is that is been communicated to the participants. And finally, they vouch for the contents that is revealed to the participant. And finally, they do sign for on behalf of the patient bystander as an impartial witness. And this is what I was already mentioning, principles of non-exploitation. There should not be any sort of discrimination when you design a study, typically during recruitment. There should not be any barrier in the form of socioeconomic status or the educational level. And there should be sufficient provision to safeguard the vulnerable group in all these studies. When it comes to the principles of privacy and confidentiality, privacy is the right of an individual, whereas confidentiality is the obligation on the researcher, to the participants, to safeguard the interested information. The privacy of the participants, their identity, records have to be kept confidential, and access must be limited only to the authorized individuals. And whenever there is auditing by any external agency, appropriate permission has to be obtained from the ethics committee. And similarly, when it comes to publication, undue publication of pictures. Whenever you take pictures of the research participant, you need to take a separate consent for this particular entity, which in most of the circumstances we see missing in most of the proposals. And whenever you publish any pictures, it must really make an impact to whatever that you are trying to communicate in the article, just not for the sake of publishing. You need to put the images. And as I said, only in certain situations, especially if there is undue positive or a negative response in a group, like to know to which particular group that the individual was belonging to, then automatically you can unfold the data and make it available for the scientific, based on the scientific or in rare circumstances and all, whenever there is a legal reason. And principles of precaution and risk minimization is the responsibility of all the investigators and co-investigators to ensure that all the research participants are appropriately given appropriate care, and if at all, if there is any injury, that it is reported and appropriate compensation is paid to them. And professional competencies, yes, this is one thing that we often see. There is a reason why whenever there is a research proposal called for, we ask for The qualification of the investigators, this is just to ensure that appropriate individuals are involved in the conduct of a particular type of study. Again, here, as a PI or co-PI, it is the obligation of each and every researcher to ensure that the study is conducted. Do not keep passing the call to the junior uh, researcher. The PI passes on the responsibility to co-PI, co-PI to the research assistant, and then it goes down. And finally, the data collection and administration of vital medications may be carried out by fellows who are not qualified, and this may endanger the participant's life. And principles of accountability and transparency, as I mentioned, the research has to be conducted in a fair, honest, and a transparent manner. The records must be retained within within various participating institutes for a reasonable period. This reasonable period is typically 5 years for any clinical trials, and for any other type of observational studies, not less than 3 years is what the data need to be maintained in the participating centers. And the outcome of the research must be brought into the public domain through these reports and publications. And the principles of maximization of public interest. The research that is conducted should it is not just you conduct and keep it within records. It has to be brought into the public domain so that things are reflected, and this can be adopted by these agencies. The institutional arrangements is something that we need to always keep in mind. The institution should provide policies for appropriate research governance and take responsibilities, and also facilitate research by providing appropriate infrastructure, manpower, funds, also the training opportunities. And we never expect this to happen whenever you are administering some vital drug or intervening with critically ill patients, and things which are not functioning should not be identified when the individual's life is at risk. So it is the responsibility of the individual to ensure that the study site is appropriately equipped. And after due experimentation and evaluation, after doing the proper evaluation of the result output, it has to be brought into the public domain through scientific forum or in the form of publications. And principles of totality and responsibility, as I said, not only during the study conduct, even when the publication comes out, it is the responsibility of all the investigators and the authors. Do not blindly sign the consent forms for being authors. Later, if there is any obligation, you cannot withdraw yourself, quoting that you are not actually being involved in the study conduct. You cannot say that once you sign the consent form to be part of authoring any publication. And nowadays, as we are in the era of COVID, the biological samples or any wastage that comes out of the study has to be completely discarded. And we all should take the responsibility in protecting our environment. And this is in one picture which depicts basic principles which involves in the ethics of conducting research. And to mention and to sum up, the Indian Council of Medical Research in the year 2000 came up with ethics guidelines, and which was revised in the year 2006. Again, if you see, there was a huge gap of nearly a decade. After 2006, 2017, we came up with national ethics guidelines for biomedical and health research involving human participants, which was in line with SIOM's WHO. And in 2017, we had similar ethics guidelines for study involving children. And in the year 2020, we had a separate ethics guideline for research in COVID pandemic. And before you design a study and recruit the study participant, always keep in mind, always for a second you realize if it was you or your near one, you really recruit them in your study. This is something that you need to keep thinking whenever you design or start.
Thank you, Lokesh sir.